It's Great Day Houston.
Yeah, oh yeah! You weren't watching just any show.
That's right.
Just right, al dente.
From celebrities, food, fashion, health, and more.
You've got to change your lifestyle.
Exactly.
Wake up with your morning cup of fun with your host, Deborah Duncan. Great Day starts now.
Hello, everybody, and welcome to Great Day. I hope everyone had a great weekend and a great Father's Day, if that applies. It is Medical Monday, and we want to hear from you watching at home. Do you have a question for our panel of medical experts? If so, send us an email to greatdayhouston@khou.com. You can also send a tweet to Great Day Houston. With that being said, let's introduce our panel this morning. Ear, nose, and throat specialist, Dr. Raza Pasha, pharmacist Gina Eubank, family medicine and anti-aging specialist, Dr. Bruce McClendon, and pathologist, Dr. Susan Rossman. Please welcome them to the show this morning.
Thank you.
All right, we want to start off with, there are all kinds of things happening in your respective professions. Sometimes it's new technology, other times it's old things that are rearing their ugly head again. Yeah. So let's start with you, Dr. Pasha. What's one of the things that you're excited about when it comes to the things that you do?
Well, one of the things that we're working on in our office is using the Da Vinci robot. I'm not sure if you heard about this, but now we're using robots in the operating room. And it gives us certain advantages, allows us to access places we couldn't access before.
Yeah, this is amazing because it really becomes your, I guess, your hands and fingers inside with less trauma to the body in the sense of having to cut open things, or perhaps?
Yeah, one example is I use the robot now for sleep apnea. And one of the areas that we collapse when we sleep at night, we have areas of collapse at the back of the tongue. And it's hard to get to with our hands because it's in the back of the tongue. So what we use the robot to access through the mouth without making any incisions on the outside of the face, and then that way we can get to the deeper parts of the throat.
That's amazing, because it can be used in several different types of surgeries, correct?
Yeah, right now urologists use it often for prostate cancer. OBGYN uses it for their gynecological surgeries, and as well as general surgeons.
Yeah. All right. We heard that the star of the Parkers and Moesha, Yvette Wilson, lost her battle with cervical cancer and kidney disease. She was only 48 years old. And unfortunately, we're seeing more and more people lose their lives at this young type of age. But according to the figures by the CDC, African-American women are more likely to die from cervical cancer. Do we know why?
Well, I mean, one thing that I really encourage is for people to get the Gardasil vaccine, and that helps prevent the HPV virus, which they have linked to cervical cancer. And that's for 26 and under. And they have really found that has been very effective in decreasing it.
Yeah, and they're saying also in certain populations the HPV virus is harder to clear.
Exactly. And so that's why it's even more important to get your child. It's a series of 3 vaccines. So I'm all about prevention, right. You know. I mean,
it was recently approved for men as well as
exactly.
It's about time.
That's right.
Young men as well. So even though they don't get cervical cancer, they get warts on their genitals. And that can be prevented, and then that can prevent them from giving it to someone else.
Exactly.
So.
In Texas, we know that it was kind of introduced with a lot of controversy because it was a government's mandate to do it, and so people reacted to that. But I guess what happened is, in the beginning, the message kind of got lost, and it became more about don't tell me what to do with my child. But as medical professionals, a good idea?
Absolutely. Very, very strongly, the studies have shown that it's very effective in prevention. And also, basic pap smears are very effective in preventing cervical cancer at a slightly older age when women start becoming active.
And the key thing when women start becoming active, that was another problem that a lot of parents had. It was like, not my daughter.
Right,
because it was a young age that we were talking about them getting, what, around 6th grade, around 12 years old?
Right.
You know, it's interesting because we talk about cervical cancer, but it also goes into other types of cancer, particularly head and neck cancer. And head and neck cancer, like laryngeal cancer and oral pharyngeal cancer, used to be just pigeonholed to smokers and drinkers. And now that smoking has come down, a lot of our cancer is coming out from HPV viruses. So now the risk factors, whether or not you've had sex more than once with more than one partner. And that becomes, that kind of opens up the field a little bit more than just our smokers and drinkers.
Yeah, yeah.
Well, and with cervical cancer and, with ovarian and some of the other ones, the symptoms, as far as you experiencing something that would cause you to go to the doctor and think something's wrong, by the time you usually go, it's
too late
way
for most
advanced.
people. Yeah,
Yes.
it's too late.
So another reason to vaccinate. So.
All right, moving on to obesity. This one comes up over and over and over again. And the reason why is because it is not an aesthetic issue, it's a health issue. And that we're seeing at the proportions today, especially with kids even. And so, we used to have type 2 or adult onset diabetes. Now it's called type 2 because it's happening with kids. One of the areas that's really affected, of course, is the liver. And we're not talking about, used to be when you see somebody who had a problem with the liver, it may have been alcohol related, but now we're talking about it could be non-alcoholic fatty liver damage.
I mean, that is on the rise. So much I cannot tell you. And, so many people, like you said, they think it's alcohol, but it's not. Your liver processes just about everything, and so that includes what you consume food-wise, what you eat, and if you're eating partially hydrogenated foods or fast foods or things like that, you're going to have a congested liver. And what they found in young children, they'll do an ultrasound on it because the way you used to do it is you'd have to do a biopsy on the liver, and that's very invasive. So now they're starting to do ultrasounds on the liver, and they can tell by the bounce of the ultrasound if it's stiff and if the progression is starting, because that puts you at risk for liver cancer, youth, obesity, and that's crazy.
Yeah, it's all kind of intertwined there. All right, in your other areas, West Nile is on the rise. We had seen it kind of go away for a while, and now it's on the rise again.
Last year was quiet. This year maybe related to the
drought.
Last year.
Yeah,
that might not. A lot we don't know about it, but maybe that didn't hurt. But this year there's some early cases in Texas already, so. We're thinking that we're going to have a lot more than we did last year.
Yeah.
So.
With that said, I had a conversation the other day with some folks who are wondering. We know that the mosquitoes can transmit, West Nile virus. Right. They can transmit malaria.
Right.
What about
dengue,
HIV and things like hepatitis?
No.
So it's interesting because people still ask that question. We know that they don't, but people still ask that question and wonder why.
Right. No, needles transmit, and lots of other kinds of contact transmit HIV and hepatitis. Lots of other kinds of blood contact, but not mosquitoes.
Okay, another thing on the rise, chickenpox. We're seeing more and more adults with chickenpox.
I had a recent case of a patient that came in with chickenpox, and it's really unusual. I hadn't seen one in an adult in about 15 years. But I just heard there was about 1,000 cases in California, and it's just because we're not vaccinating. There was a lot of kids that they went through a phase where the parents didn't want their kids to get vaccinated because they were concerned about other disease processes. And now we're seeing this resurgent. And it's a very uncomfortable disease. It causes blisters and boxes all over your body. And it tends to run a course of about 5 to 7 days, and you can't be out in public with it.
Yeah.
And actually in adults it can be more severe because it can be pretty hard on your system.
Yeah, and of course if you have a compromised immune system, you have to worry about shingles as well, right?
Well, actually, chickenpox, when you get it, or even immunization, when you get it as a child, you have that in your body, and at some point in time, usually when you're older, you can get, it becomes the shingles, so it can break out in a different form.
Yeah, and there's actually a vaccine for that.
Yes, there's a vaccine, and the virus will lie dormant in the nerve cell. And so if you're under stress, or like you said, your immune system is compromised, you can break out the shingles. And we've had a lot of people recently that have been breaking out. And if you're in the sun a lot too, think of the fever blisters and things like that. I've had some patients that, seniors that have gone on tropical vacations and come back and had shingles, and they weren't under stress. They were having a great time, but they probably ate too much, drank too much, and were out in the sun.
The body was under stress.
Right,
They were under stress mentally, but the body was under stress. Okay, so now you know. Our medical experts are staying with us. If you have a question, email it to greatdayhouston@khou.com or send us a tweet at greatdayhouston. Okay, coming up, it's summertime, and your nose knows it because you keep sneezing. If you have continuing sinus infections, antibiotics could make it worse. New options for allergy sufferers next.